I'm Rebecca.
I'm Vicki.
This is Aging Answers, a podcast for families sorting out senior services.
If you're helping a parent or planning for yourself, we make the maze simple.
We cover care at home, assisted living, memory care, transportation, safety, and money questions.
We also explain benefits, Medicare, Medicaid, VA, and how they actually work in real life.
Each episode, you'll get a quick map of your options and simple next steps. No jargon.
No guilt.
Just clear answers so you can move forward.
Welcome to our podcast, Aging Answers, where we talk about everything related for mature adults and hopefully answer a lot of important questions. Rebecca is the co-host. I'm Vicki, and our special guest is
Cindy Bachman, and she works with Medicare.
Hi, I'm Cindy Bachman, and I've been in the insurance industry since 2013. For about the last year and a half, I've been working with Southwind Agency in Dahlonega, focusing on Medicare products and health insurance.
And the Medicare open enrollment is right now going on.
It is. Yep. Annual enrollment started on October the 15th, and it ends on December the 7th, so we are right in the middle of it.
Okay, and tell us a little bit about that. If you're either on Medicare or you haven't gotten on Medicare yet.
Well, the annual enrollment is for people to review their prescription drug plans or their Medicare Advantage plans and make changes if they want to at that time. To enroll originally for Medicare, you would do that either 3 months prior to your birthday, the month of your birthday, or 3 months after your birthday.
Okay.
So you have a 7-month time period to enroll when you first become eligible.
Well, what are some of the changes then that people should be reviewing right now? What should people be looking at?
Yeah, so everybody should have already gotten their annual notice of change, so it's really important to have reviewed that. There are some changes coming, so you just want to look at your plan specifically, make sure that your drugs are still covered, and then also see if you've had a change in premium. The prescription drug plans, a lot of them have increased in premium, so you just want to check that out and see what you're looking at for next year. With prescription drugs, the deductible is increasing. This year it was $590. Next year it's going to be $615. So that's one change. And then also our catastrophic limit on the prescription drugs is increasing from $2,000 to $2,100. But just keep in mind for those folks that have those more expensive medications, when they go to the pharmacy early in the year, if that deductible is hitting them all at once, they can enroll in the Medicare prescription drug payment plan that was implemented in 2025, and that makes it so that they can opt to take that cost and just spread it out throughout the year. So if they're not enrolled in that already and they would need to be, they just need to contact their insurance carrier.
That's very good information.
What is the difference between the traditional Medicare and versus an Advantage plan or a med coverage?
Yeah, so there's Medicare Part A and B. So Part A covers your hospitalization. Part B covers outpatient things and physicians, things like that.
Is that the physical therapy?
Right.
Your home health or physical therapy?
Right. Doctor's visits and things like that. But it doesn't cover everything. So a lot of people will choose a couple of different options. Option one would be a supplement plan, or Medigap is what some people call it. So that just kind of layers on top of Medicare Part A and B. So where it ends, there is a deductible, but then the supplement plan would pick up and pay the rest of the expense. It does not include prescription drugs or vision or dental. So when people have just original Medicare with a supplement or just original Medicare, they need to also be enrolled in a prescription drug plan. And if they don't enroll in the prescription drug plan when they first become eligible, they'll end up having a penalty that they have to pay later on. So you want to make sure and get enrolled in that right away. The other option besides the supplement plan is a Medicare Advantage plan. So with the supplement plan, you have an additional premium each month in addition to your Part B premium. With the Advantage plan, you typically don't. But the difference is it works more like traditional healthcare. So you have a network of doctors you can go to. You have copays that you pay when you go to the doctor. So the cost up front monthly is less, but you just have to make sure and stay in network. And then, sometimes those out-of-pocket expenses can get high.
Now, if you're on the Medicare Advantage and then you decide to change to a gap plan.
Mm-hmm.
Is there is there a problem with that?
There could be. So you would do that during annual enrollment. You would have to medically qualify. So there are some underwriting questions. So if someone has been on an Advantage plan for a while and they've developed some health issues, they could potentially not qualify for a Medigap plan. So that is something really important to keep in mind.
So if you're on Medigap, you can always switch to Advantage.
Right.
But if you're on Advantage, it may be more difficult to switch to Medigap.
That's right. Yep.
Okay. And then I've had some friends that are turning 65 and they're still employed, and they really like their health insurance. And so they didn't enroll in Medicare when they should have. So what are some of the issues? If once you turn 65, you have to enroll in Medicare. Is that correct?
No. If you have a qualifying health plan with a prescription drug plan, then no, you don't have to. You may as well enroll in Part A because it doesn't cost anything. And then once you quit working and you don't have that health coverage anymore, then you would go ahead and enroll in Part B and choose your supplement or Advantage plan. But you do need to have a qualifying prescription drug plan along with that health insurance in order to not have to go ahead and enroll in the prescription drug plan through Medicare.
Okay.
What are some things that you're seeing that are changing with the pharmacy drug plans that are coming out?
A lot of the drug plans are increasing in premium, so that's something to keep in mind for next year. The Medicare was able to negotiate the cost of 10 very expensive medications. So going forward, that should save a good bit of money for both Medicare and the beneficiaries. And those are the major changes, I would say, for next year.
Perfect. And then what are the premiums kind of looking like?
So the Part B premium is what typically comes out of someone's Social Security. And for most people, they pay $185 a month right now. Going into 2026, it's projected to be $206.50. So it's increasing a little bit.
Okay. What are some other things that you want to talk about that maybe we don't know what to be on the lookout for?
I would just go back and reiterate that we need to make sure and review your plans each year. Make sure that, especially if you're on an Advantage plan or prescription drug plan, you want to make sure your doctors are in network and that your prescriptions are covered. One other major change for next year that's going to affect a good amount of people is there are a lot of people that are enrolled in Medicare and Medicaid, and they have, so they're dual enrolled and they have a specific kind of Advantage plan. Well, they have, a lot of them have had like a benefits card, like some extra benefits where they could, or some extra funds that they could use for food and utilities and things like that. So going forward in 2026, they're not going to be able to use those funds for everything. They're going to only be able to use those funds for over-the-counter items like Tylenol and Band-Aids and things like that. The exception to that would be someone that has a qualifying chronic illness. They would still be able to use those cards for other expenses like food and utilities. However, there will be some restrictions. So in the past, they haven't really been limited on what type of food. Going forward, it'll have to be healthy food. Things like that will change.
I think that's a good change.
Yeah, I think so.
So how can we find you?
So you can call me, 706-701-9001, or you can email me. It's Cindy@southwindagency.com, and Cindy is Cindy.
And Southwind is out of?
At Dahlonega.
Dahlonega.
Yep. So just Google us.
But you can help people in the whole state of Georgia.
Right. Anywhere in Georgia.
Yeah.
Do you only deal with Medicare?
No, we also do individual health insurance and life insurance.
Okay.
And group plans, things like that. Anything in the life insurance and health insurance field we can help with.
Okay.
Yeah. Yeah, I know you've helped me with a lot of my residents that come in from out of state that have to switch their plans up. And so we have utilized you often.
Yeah. Well, I just love working with them. It's so fulfilling to be able to just help someone in that way and kind of calm their nerves, because it is overwhelming when you don't deal with insurance all the time. It's very overwhelming. So to be able to help someone and just find a way for them to not have to come out of pocket so much money it's very rewarding.
So is moving out of state something that you have to look into with your Medicare?
That's a great question. Yes. So you do have to change. If you move out of the zip code that you're in, then it's very possible that the plan that you're on is not available to where you're moving to. So you want to make sure if you're planning a move to get ahead of it and call your agent or just call the company you're with and find a plan that's available where you're moving to. And you'll want to do that ahead of time so that you don't have a lapse in coverage.
Okay, so is that like what they call a life-altering thing? So
life-changing event?
Yes, a life-changing event. So you could do that. It doesn't have to be during open enrollment.
Right. So that would create a special enrollment period for you.
Okay.
That's right.
Okay. What are the most frequently asked questions that you get from people signing up for Medicare for the first time?
Well, one question we've gotten a lot for this upcoming year is are the prices of insulin going to go up? And they're not. They're going to remain capped at $35 per month.
Oh, that's awesome.
We're having a lot of discussions about those spending cards. What are they going to be able to buy with those? How is that going to change? So that's been a big discussion this year. And unfortunately, there's a lot of people that depend on those funds for groceries and things like that. They just aren't going to have them anymore. But they still will be able to use them for medical supplies. So that's what we're having a lot of conversations about this year.
That's awesome.
Yeah. Another thing that's kind of changing that's cool is Medicare is kind of upping their online game. So you can set up an online account with Medicare. You can sign up to get email updates and kind of keep up with your claims and your prescriptions and things like that directly on the Medicare website.
Okay. On the GAP plans, like how many different GAP plans in an area like this size?
Yeah, so there's a lot, and they vary in prices. And so they when you first sign up, so when you're 65, it's going to start out around, $140, $150 a month, just depending on what company and where you're located. But they do increase over time. So, it's even to change from one plan to another, you still have to qualify medically. So if you're a healthy person and you feel like your prescription's your plan has gotten too high, you can reshop it and probably be fine to change to another plan. But if you've developed some health issues, then you probably just need to stay with the plan that you're in. And there's sometimes people get to where the supplement plan is too high for them to afford, and so at that point they change to an Advantage plan. But then they lose that ability to go to any doctor that takes Medicare. They have to stay within a certain network.
Okay.
So when they call you and they're shopping these plans, do you help them kind of take everything into consideration? Like, you're on these medicines, so we'll shop the best plan for you specifically?
Yeah. So when we evaluate somebody's situation, we get a list of their prescriptions and their physicians. And so we input all of those into our system. And we can look at each plan and see if those doctors are in network and if those prescriptions are covered. And if they are covered, what is going to be the out-of-pocket cost for that person. And then we also check the pharmacy to make sure that they're using a pharmacy that's covered. So we take all of that into consideration. When somebody is turning 65 for the first time, we getting enrolled, we go over, the differences, like what their options are, can go in, supplement versus Advantage plan.
Yeah, absolutely. I know that recently we learned that not all pharmacies were created equal. So some,
right.
They're not like your CVS's where you can walk in and buy shampoo and over the counter. They only do communities like senior livings where that's all they can accomplish. Mm-hmm. And so when they do that, then not every plan covers them. And so that's something that Cindy taught me recently. She helped me get coverage for a very specific resident.
Right. Yeah. It was gonna cost her, tens of thousands of dollars if she wasn't in a plan that was where the pharmacy was in network. And so there's actually a new plan in this area that's available that will work for her. So that worked out well. So
talk about a Hail Mary.
Yeah. I was glad that worked out.
Me too.
And so that's specifically prescription drug plans. And so that's what people can change right now.
Well, that was actually an Advantage plan, but yes, either or a prescription drug plan or a Medicare. A Medicare Advantage plan includes prescription drugs.
Okay.
Yeah. So Medicare Advantage, I guess I didn't mention that. An Advantage plan typically includes your drugs and your dental and vision. Not all of them, but most of them do include that.
And then the GAP plans, a lot of them don't include anything.
Mm-hmm.
You have to add on the dental, the vision, and the prescription drug plan.
That's right. Yep.
Do you feel like that's a big draw to do Advantage plan versus traditional Medicare?
I think it just all depends on the person's situation. So if somebody has some health issues where they foresee, having some big out-of-pocket cost, then they may want to consider the supplement plan, because even though they're paying more monthly, they're not going to have the copays and the the out-of-pocket expenses that they would on an Advantage plan. Now, an Advantage plan does typically have a maximum out-of-pocket, so there is a limit to it. But you just everybody has to evaluate their own situation. They need to just talk with someone and figure out all of the options and see what's going to be best for them specifically.
Yeah, perfect. Cindy, where can we find you?
You can email me at cindy@southwindagency.com, and that Cindy is spelled Cindy, or you can call me at 706-701-9001.
Perfect. Vicki, where can we find you?
You can find me at Anchor Real Estate Advisors. I am a senior real estate specialist, and you can find me on their website.
Perfect. And then I'm Rebecca Cox. I work with Manor Lake Senior Living. We're all over North Georgia, and we're spreading throughout. Our specific website is manorlakedw.com. And you can find us, Aging Answers, on YouTube, iHeartRadio. You can find us on Spotify, Apple Pod. And we really love helping mature adults live better today and answer questions. So make it beautiful.